Chemotherapy is a science which takes the substances like chemicals. These are medicines which are made from either a plant extract or could be derived or could be made. And these things are injected or given as a tablet form or given as in the cavity wherever it is needed. And this science will make you heal from cancer by reducing the tumor size. Types of chemotherapy. We have 4 types of chemotherapy. One is curative, where the intent we will give it as a curative intent. 2, it's called neoadjuvant. For a cancer treatment, we have something called a definitive therapy. This means that it is must and needed for the tumor to convey as fast as possible. So after definitive chemotherapy, what you give is called adjuvant, and what you give before the definitive treatment is called neoadjuvant. So apart from these 3, we have a 4th one called palliative chemotherapy, where our intent is only to give comfort to the cancer patient, not to cure. As a side, after the definitive therapy, where a surgeon can remove what are the margins with the clear distinct margins, what he can see on table is removed, but what I and you want as a patient caregiver and or as a patient is for the cancer not to come back. So what we are addressing by adjuvant therapy is we don't want it to come back. So the adjuvant therapy will address all the little amounts of probably a microseeding somewhere, anywhere, which should not come back later. So that adjuvant therapy will address so that it prevents these recurrences. Palliative chemotherapy, as we've already discussed, is a specialized branch where your concern is not just ending the cancer. We want the patient to be soothed, comforted, and healed from what our cancer has caused to him or her. So this chemotherapy will give him comfort and reduce the disease load or burden. Added with the pain medication and supportive care, patient would feel better. Irrespective of malignancies, in a term that neoplasia, what we have is benign tumors and malignant tumors. So in the malignant tumors, what we can address are based on the tissue of origin. Where are they coming from? Say it mesenchyma, say it coming from the stem cells. So in business way, we have different type of cancers, the carcinoma, sarcoma, melanoma, leukemia. All are derived from their respective parent cells. So we addressed the tumor cells accordingly based on their origin. So cancer chemotherapy staging is really important. You have to go through a set of investigations initially to find out what stage it is. Many patients do complain it's taking a longer time. It is taking our patients time in not receiving the treatment first. But please understand, knowing the stage is very important to plan for the treatment. Until the staging is not done, we cannot plan a further treatment. So when do we treat a given stage? It depends on a type of cancer. Stage 1 cancers do require chemotherapy, and stage 4 cancers also require chemotherapy. It depends on type of cancer. These osteosarcoma, Evans sarcoma, lead breast, stage 3, borderline 2, definitely a 4. So it depends on what type you are dealing with, so that we will customize the treatment according to your stage and type of cancer. Chemotherapy is typically given, usually what general public knows it, is through an injection, which will make the patient feel very bad, sad. So on the other hand, we have chemotherapy being given in multiple ways. We have 2 types of tubes, I would say, in the body, arteries and veins. So most commonly we give to the intravenous one, the next one is the oral, and the third one is arterial, and the 4th one you call as cavitary, like in abdomen, where you give chemotherapy directly, pipette, something like this, or directly into the tumor, like in liver, we can give it intraarterially and embolize the given tumor. So all these are the types of ways where you administer chemotherapy. We'll learn how chemotherapy works and little on how it comes. See, the cancer cell is a disturbed one, which it's like a mad hatter which doesn't know how to divide, and it divides rapidly, uncontrollably, unlike any normal cell. So what is needed for that? A DNA. DNA is your gene print or blueprint, which will decide the cell's further growth, development, and its pathway to go and see somewhere else. That DNA, and then how is it synthesized? Products from which the DNA comes from, and then where it has to get the blood supply through. All these things do matter for a cell to become cancerous. So chemotherapy addresses different steps of this pathway of cancer genesis. Okay, so there are multiple drugs which target the mitosis, which target the DNA synthesis, which target the blood supply, which target the blood sequence. All these will be the multiple types of chemotherapy which you see. Side effects of chemotherapy could be divided into, I'd say, acute and long-term complications. Acute, yes, the most common is fatigue. You feel so much tired. It's basically the chemotherapy doesn't know which cell it is targeting. It targets equally a normal cell and also a cancer cell. So when it's targeting also a normal cell, it gets impact in your body in the form of fatigue. The next common thing would be nausea. And the next common thing will be constipation, diarrhea, and hair loss. And the most importantly, the decrease in the blood count, especially the WBC and platelets. All these are rapidly proliferating cells. That's the reason why they are mostly you have it in low counts. So to minimize that, how we can do this? You can avoid having this with all the antiemetic medications what we are giving. We have our own publications which have made it to ASCO practice changing guidelines, where we have a good number of drugs which will decrease your nausea, vomiting, constipation and diarrhea. Yes, diarrhea, while giving chemo only, we can ask them to chew ice cubes, which would decrease the leukocytes and also diarrhea, thereby constipation. Yes, we can address that. Low counts, very fortunate that these days we are blessed with growth factors. When the counts come down, we can give an injection which are the growth factors which will increase the WBC and thereby the immunity. So all these things we have definitely to minimize all your side effects. Chemotherapy is certainly for cancer. Very rarely we do use, like in autoimmune diseases, we use cyclophosphamide, cyclosporin, we use, but it's rare, rare in the sense, autoimmune disease, yeah, we do use when it goes beyond steroid. Chemotherapy is effective, as I told you, on you as a caregiver or as a patient and me as a medical oncologist. We don't want the cancer to come back. So it is an effective measure for cancer cells to get a checkpoint for them, not to go further and not to come further. And even if it comes, we have next lines of management too. So it's not gone on those days where a cancer patient with a stage 4 disease is going to see the end within a month or two. It only depends on the patient's performance status we see. But these days, we have a stage 4 cancer patients living longer with 3 to 4 lines of treatment. So no, it is effective. It is helpful. Please don't bother on that. Yes, high-dose chemotherapy is typically given in hematological malignancies, in bone marrow transplant, where the dosing, it's the same drug where you give in a palliative setting or an adjuvant setting, the same cyclophosphamide is being used in a much higher concentration. But it's not, don't worry that it's not out of the proportion what your body needs. It's only just what it is needed for your cancer to be curtailed. That's it. Chemotherapy is painful? No, never. I would say while administering, but while an intravenous line is going, I would experience that too. That's the pain what you would have. To avoid this, you can get into multiple devices installed in like thick line, a central line, or a chemo port, so that you won't get filmed multiple times and get your veins charred. That's the only thing. Else, while giving chemotherapy, few people would have burning, but no chemotherapy will cause you pain. The side effects like mucositis, the diarrhea, that kind of pain is possible, but not due to as such while giving the drug. Chemotherapy was expensive, it will be expensive. But what you need to know is we have a pill which starts from rupees 5 to 10, which per day, versus a cycle which costs up to 1 lakhs for 3 weeks. Doesn't matter. Funds or the socio-economic burden on a given family or how is it costly should not make a person stay away from cancer therapy. This is what Pace Hospital believes in. So come to us. We will take care of the finances. It is not about how costly it is. It's about how can we customize as per a given patient status. Chemotherapy, unfortunately, will not be able to cure a patient with stage 4 cancer. It's called a palliative treatment. Palliation in the sense you are giving the patient soothing, comfort, and a healing touch, along with as you address the pain or cough or respiratory distress or diarrhea or constipation. It's the comprehensive care you address them with, along if needed a chemotherapy. If the performance status is good for a given patient, then it will be able to control the disease but never can cure it. Best food to eat after chemotherapy. I would say the initial first week, patients, because of nausea and vomiting, they will have no appetite. Take it from me, you will have no appetite probably at all. But all I regularly say to my patients is, see the time, see the watch, and then have your meal. Your appetite will not give you a hint to even have a food. So as per the clock ticks, please have a small frequent meals. Initial first week, have something which is soothing like coconut water or a little of more of hydration. And later on, as your gastritis settles in or the mucositis settles in, always include protein in whichever form. Decrease the spices, decrease the chilies, and then give protein in every meal, a short, small meal where you can digest it easily. You can have water, but only remember, it's always should be prepared at home. Differences between chemotherapy and radiation. Chemotherapy is a form of drug which is given in multiple ways, orally, IV, intra-arterially, whatever it is going in, acting all over through the body, and then is causing mostly the cancer cells to come off, and then a little of normal rapidly dividing cells to also decrease their turnover so that you get the side effects of mucositis. On the other spectrum, radiation is given as a beam. It's like an X-ray which goes and hits the area of as planned, as the radiation oncologist plans it for you. It will go and hit right at the target. It could be as in concurrent with the chemotherapy, it could be sandwiched between chemotherapy, it could be a palliative radiation. The beam goes there, tries to consolidate, decreases the turnover rate of the cancer cells. That's how it works. So chemotherapy, as I told you, it doesn't know what is a normal cell, what is a cancer cell. It will go attack all the cells. If it is a highly proliferating cancer cell, definitely the tumor regresses when it's acting on a normal cell, but which have a high rate like hair loss or a mucositis or diarrhea, constipation. It acts on everything. Immunotherapy, on the other hand, why do you think the cancer is happening? Cancer is happening because your immunity was not able to check. You inherently, everyone has the checkpoints, and the immunity will curtail the cancer. Something had escaped that mechanism, and then cancer had explored in your body. So what immunotherapy tries to do is it elevates the senses of your immunity system, and these immune cells go and trigger and act specifically on the cancer cells only. But the only side effect is not unlike the chemotherapy. The side effects are mostly autoimmune related because it goes and also activates the lymphocytes in the respective organs. Yes, chemotherapy treatment will result in hair loss. As I told you, the rapidly turning over cells in our body are hair, the mucosa, inner lining of our entire gut, which will cause ulcers in the mouth and also constipation or diarrhea in the entire GI tract. Yes, it will cause hair loss, but yeah, you can decrease it with various methods. You have a scalp cooling technique, or you have many of the topical applications which would make the cells, hair fallness apart, even if these are not available in anywhere else where we do actually provide. You also have an option of zig, where you can live your normal social life. We would provide an assistance with that too. Yes, hair would definitely grow after chemotherapy within maximum of 3 to 6 months, not more than that. Only thing is, it's very beautiful how relationships between a mother-daughter or a father-daughter shows up, where the caregiver also shaves their head and comes giving respect to the treatment which the child or the mother is going on. Yes, chemotherapy does affect the fertility in the sense that a rapidly proliferating high turnover tissues in the body are also the reproductive organs. We cannot do out of the fertility, but you can do something which is preventive. So, and we can offer you few of the reproductive medicine specialists for whom we have in touch with. You can get in touch with them. You can preserve the ova, you can preserve the sperm accordingly, and that will take care of your fertility for later years. And it also depends on the type of chemotherapy you're being using through. Regimens like ABVD will not cause so much of infertility, not less than 5%. Regimens with ifosfamide, on the other hand, will have more chances of infertility. Chemotherapy affecting your memory or cognitive function. Yes, we have an entity known, something called as brain fog or chemo fog, where you feel that you're not able to recollect, but it's very temporary. You will be getting back to your memories soon. It doesn't happen to everyone. Chemotherapy is definitely safe, but under an expert supervision. That's the reason why you don't see just like antibiotics, chemos being given everywhere and anywhere, be it in RMD or at in-house practice. Under supervision of an expert, yes, it is safe with all the amenities to take care of any anaphylaxis or allergic reactions. Chemotherapy as such would not cause an urinary incontinence, but there are few drugs which can irritate the bladder, like the cyclophosphamide, ifosfamide. We have protocols developed based on that, where they will try to minimize the bladder irritation with few of the drugs called like Mesna. But those things could be taken care of. All you might be feeling is a little increase in frequency or little dysuria or a little of hematuria. But this is not as such because of the incontinence. This is because of the irritation of the bladder. No. A neoplasia has two spectrums, as we discussed. It's a benign and malignant. Malignancy is where we come in and take care of. Benign, no. Maximum at the risk of cosmetic, or it is causing any indentation, you will require a surgical excision, but not a chemotherapy.